Good morning, everyone. I come from Zhongshan Hospital of China. It's a great honor for me to share a study today. This is a phase 2 study of stereotactic body radiotherapy combined with sintilimab, a PD-1 inhibitor, in patients with oligometastasis of hepatocellular carcinoma. As we know, SBRT is an emergency treatment for oligometastatic cancers, including HCC. It shows a favorable local control rate with low toxicity. However, outfield progression is the main reason of treatment failure, especially for recurrent patients. Recent data shows a synergistic and tumor effect when combination of SBRT and immunotherapy, so we decided this study by the hypothesis that combination treatment, which will stimulate the immune response against the tumor cells, will prolong PFS and enhance the objective response. In this study, inclusion criteria included recurrent and unresectable HCC with no more than 5 lesions. SBRT to own lesions was started from cycle 1, day 1, and sintilimab was administered every 3 weeks until progression or unacceptable toxicity or up to 12 months. PFS is the primary endpoint, and the second point included safety and tolerability, ORR, DCR, and overall survival. At the data cutoff, 20 patients were enrolled, and we can say most patients had HBV infective, and 17 patients had intrahepatic recurrence. 5 patients had extrahepatic recurrence. Among these patients, 12 patients were still on treatment, and the others were treatment discontinuation, including 2 patients were treatment completed, and 2 had disease progression, and 2 treatment-related AE. And 16 patients have received at least one tumor assessment. In results, we can say the ORR was 93.8% with 10 complete response and 5 partial response. The DCR was 100%, and the 1-year local control rate was 100% too. Median DOR was not reached, and the median PFS OS were not reached either. 6 months PFS was 100%, and 1-year PFS rate achieved 71.4%. This result seems better than those used SBRT alone previously reported. Total treatment-related AE occurred in 40% of patients, and only 1 patient experienced grade 3 treatment-related AE, and SAE occurred in 3 patients. No unexpected toxicities were observed. In conclusion, in this preliminary analysis, SBRT plus sintilimab showed encouragement anti-tumor activity in treatment of oligometastatic HCC. Combined treatment shows high response and promising PFS. More importantly, this combination was safe and tolerable. However, more patients and longer follow-up are necessary to confirm these results. Last, thank you for your time and an early wish to Happy Chinese New Year.